Okay, it looks like a few more people may still be getting on, but we're after our start time, so I think we'll go ahead and get started. I'm Ruth Malone from UCSF and the upEND Tobacco Project, and this is the fourth of a four-part webinar that we've worked on with the ASH folks. And to introduce my co-upEND people, Dr. Patricia McDaniel up in the top there, and Dr. Libby Smith, who is going to be presenting today. And just by way of a little background as to how this webinar series came to be, in thinking about endgame and moving towards endgame in California, obviously one of the things we want people to do is to quit using tobacco. But why is it so hard to quit? One of the reasons that it's so hard to quit is because it's so normalized. It's for sale everywhere. We continue to act as though it's a normal consumer product when we know that it really is not a normal consumer product. And that makes it even more difficult for individuals to try to get free of it. So we started thinking, okay, institutions need to quit tobacco too. And what do we need to be doing to prepare for that institutional cessation to happen? And we don't have all the answers to this, but this is because we are moving in this direction, we are wanting to raise the questions that need to be answered and to think about the kinds of resource decisions that need to be made as we move towards achieving the end game in California. So today, as I said, we don't have all the answers, but we are pointing to some of the questions that we all need to start thinking about. And of course, at the local level, you may not be directly working on state policy, but as we know, we have a model of working from local jurisdictions up towards the state. So I think it's really helpful for all of us to be thinking about what does it mean to move in a direction of the state actually quitting tobacco too. So what does tobacco cessation look like at a government level? And so I think I will leave it at that. And we're hoping to have some time. We should have some time at the end for discussion and questions and brainstorming about this, because really these are the kinds of questions that require everybody to be thinking about doing things that haven't been done before. So with that, I'll turn it over to Libby Smith, Dr. Libby Smith.
All right. Hi, everybody. Thanks for coming. So as Ruth said, I'm going to be talking about how the state needs to quit tobacco and how we can maybe get closer to doing that. Let's see. Except now I cannot move my slide, although it did a moment ago. There we go. So, as Ruth said, we tend to have this focus on individual cessation, which we think of as, being a voluntary process. But, for institutions, it's going to be a little different. But one thing that I think that will remain the same is that, even though we have a lot of cessation techniques and tools that work on a statistical level, it's hard to know what is going to work for any given individual. And so we end up trying a whole lot of different things. So what is institutional quitting going to look like? Well, if you've been to some of our previous webinars, we've talked about how we need to make the industry quit. We have to get retailers to quit. And now we're talking about the state. And one way to approach this is to think about educating policymakers about institutional cessation. And I'm going to talk about that in a minute. But before I do, I want to take a slightly different approach to this question and say that, we are the state, right? We are the state on because we live in a democracy, and we need to think about this as sort of being the state. So I think we're kind of in this place right now where that's familiar to a lot of people who've helped people quit or have quit themselves, where it seems like a great idea to do, but it also seems like it's going to be really hard, and we don't know quite how to do it. We know that using tobacco, that having people in the state use tobacco is bad for us and bad for the state, but we're not really sure what life is going to look like without tobacco. And, as with individual quitting, we are probably going to need to try many approaches. And of course, we already have tried many things and we've come a really long way. So I think that just having that kind of perspective on what we're doing might be helpful as we think about going forward. We have to remember that no state has ever quit before, and so we don't know what the answers are. We don't know all the things that might work. We don't know all the things that will work. We're just going to have to try. So one important way of doing that, as with individual cessation, is making endgame ideas part of the conversation. We have to, just as we've normalized tobacco use in the past, now we have to normalize the end of tobacco. And one way of doing that, is to talk about it. And I imagine that a lot of you have kind of gone through this process yourself. I mean, I certainly have, right? When we first started talking about these ideas, it seemed crazy, seemed impossible, didn't know how we were going to approach it. And now, as we keep talking about it, as we keep making baby steps, as we keep passing new policies, it becomes more and more possible. And so having it be part of that discussion is a really important step. We need to remember, the difference between tobacco control and the tobacco endgame is that we don't have to continue to assume these ongoing costs, and the carnage of commercial tobacco sales will just continue forever. And we've done this before. We have quit other products such as asbestos and lead paint. In fact, it's a normal thing to do. When something is found to be toxic and harmful, they're taken off the market. It's really only tobacco that's been given this pass. So that's another way of kind of normalizing this idea of ending the tobacco epidemic. We need to remember that California is a leader in tobacco control. Of course, we were a leader with smoke-free workplaces, with smoke-free bars, with smoke-free outdoor areas, and now with a flavor ban. And so we have a record of past success, and that's both gotten us to a place where we can start talking about this end game, and it's it shows that we have the capacity to make these larger steps. But the end game is it's a global movement, and so we need to maintain our leadership. We're going to have to watch what other people are doing, and and keep ourselves in the vanguard. So New Zealand is moving to reduce retail outlets by 90 to 95%, as well as implementing a number of other very advanced tobacco control policies. So we're going to need to watch them and maybe get some ideas. Other countries have other end game goals, some of which we're pretty close to achieving or passing, such as getting prevalence rates down to about 5%. So we need to work to maintain our leadership. And as with all of our tobacco control successes, really, it's going to be about local policy at first, and eventually having the state sign on. So that's what we did with smoke-free laws. That's what we did with flavor bans, and now we're finally getting to a point where, we can see that having the state take more responsibility for enforcement of that flavor ban could be really helpful. And I think that's going to be the approach that any novel policies we adopt in furtherance of the end game. That's probably the playbook we're going to follow. So when we think about convincing policymakers or legislators, to that the state needs to quit, what kind of approaches should we take? I mean, one basic thing is, of course, having success at the local level for whatever novel policy we're trying to get passed, right? That assures legislators that these policies can be done, that there are, are not terrible consequences, and that they have the desired effect. But the other thing we really need to emphasize at the state level is that the downsides of tobacco sales really overwhelm the upsides for the state and for the population of the state. And, this generally comes down to money when you're talking about the state legislators, right? Because one of the things they're concerned about is state tobacco taxes and, what is going to happen with the funds that we get from state tobacco taxes. Well, first of all, of course, tobacco use is declining because of all of our past successes. And so a lot of those taxes and tax dollars are going to go away. And of course, by raising the tax substantially a few years ago, we kind of delayed that point. We got a big boost in the tax money, but that can't last forever. So we need to be preparing for the end of tobacco sales and the end of tobacco taxes. But the other thing is, that despite getting this tax money, ultimately tobacco really costs California and costs Californians. So the overall costs of smoking in California were estimated in 2009 to be 18.1 billion. And we were only receiving $900 million in tobacco tax revenue. So we were really the amount of tobacco tax revenue was dwarfed by the costs that the state was feeling through tobacco use in the state. The cost to Hispanic Californians has been estimated at not only 44,000 years of life annually, but $711 million in productivity and $1.9 billion overall to the Hispanic California population. So, some of these costs come directly to the state and some of them are borne by individuals in the state. Similarly, with African Americans, it's been estimated that tobacco use costs 49,000 years of life annually, and over $1.8 billion. This is expressed in 2008 dollars. So, these costs are huge, and not only huge, but highly disproportionate. For African Americans, they make up 6% of the California adult population, and yet 13% of smoking attributable mortality costs. So from an equity perspective, tobacco use is not helping the state at all. And tobacco control programs are highly cost effective. So an estimate was that they cost $2.4 billion from fiscal year 1989 to 2008, but the cumulative healthcare expenditures were $134 billion. So that is a huge return on investment, and we have to persuade our lawmakers of that. We need to remember, from a financial perspective, we're costing ourselves way more money than we're gaining in taxes by allowing tobacco sales to continue in the state. And, when you find yourself in a hole, the first thing to do is stop digging. And that's what ending sales would mean. So what are some of the policy options? Well, there are a whole lot of retail policy options. You can reduce the number of retailers. Tobacco-free pharmacies is one way to do this. This can be kind of an easier lift, partly because many pharmacists don't want to be selling tobacco, and many people believe that tobacco products don't belong in pharmacies to begin with. There are also the possibilities of density regulations, where tobacco retailers are not allowed to be within a certain distance of one another. or you have limitations on particular areas of the number of licenses allowed in a particular area. You can ratchet down licenses by not issuing any new ones and not allowing any transfer. Of course, we have the example of Beverly Hills and Manhattan Beach, who've ended sales of all tobacco products, and that's something I know that a few other jurisdictions are working on. And I think we're really going to need to watch New Zealand for potential lessons on how they're going to reduce retailers, since they're reducing them by such a large amount. It'll be very interesting to see what approaches they take and how those go over with the retailers. These kind of policies are legal. Dozens of cities restrict the number and density or types of retailers permitted to sell tobacco. And of course, the 2009 Federal Tobacco Control Act specifically allows states and localities to reduce sales to the extent of actually prohibiting sales. That's specifically mentioned in the act that is allowed. And we're going to need your ideas. So, localities are laboratories for new ideas. That's how it's always worked in California, and that's how it's going to continue to work. Your local activity will encourage the state to act eventually, as well as encouraging other localities. And you need to remember that, of course, most policies sounded totally crazy at first. People thought at the beginning that it was going to be impossible to have non-smoking sections in restaurants. That was kind of the first step. And, no smoking flights, that was considered completely crazy. So, kind of let yourself try to think of these things and, open up the door to ideas that even might seem a little nuts, because you never know. Now, there are going to be some hard problems that the state is going to need to solve, and some of these will, be things that you need to address, but a lot of them will need to happen at the state level. So, ending sales, of course, will eliminate funds in terms of taxes and then also licensing fees, but some health costs are going to persist. We're going to have a long tail of health costs because of how tobacco affects health in the long term. Tobacco control and other activities are going to need new sources of funding. So we have a diagram here of where the tax dollars go, the tobacco tax dollars. And we can see that, we've got, several $1 billion in tobacco tax revenue. But it goes to a lot of different places. Tobacco control, we're happy to put ourselves out of a job, basically. But we also have many programs in the state that get tobacco tax monies. So the state dental program, the graduate medical education program. We've got, all kinds of programs that are right now are depending on tobacco money. And that is going to have to end. So that's definitely going to be an issue for the state. As you can see, actual tobacco control money is a pretty small portion of, takes a pretty small portion of the funds that come from tobacco taxes. And we're going to have to continue to enforce without tobacco license fees. That's definitely going to be a problem that we have to solve. We're going to have illicit sales, we're going to have internet sales, and there are going to be tribal sales issues that we're going to have to keep working on, even after, even if we ended all commercial tobacco sales within the state. So that's another problem. But, it occurred to me, that again, thinking about this as, as the state, as a person considering quitting, every person quitting wonders what will replace tobacco in their lives, right? They wonder, how are they ever gonna make friends at a bar? How are they going to take a break from work? How are they gonna, suck up to their boss? How are they gonna do all kinds of things that they feel tobacco enables them to do? And I think that's sort of where we are with the state. This money is gonna go away. We wonder what's gonna replace it. We don't know that yet. But just as smokers resolve those problems, they figure those things out, I think the state is going to figure those things out too. And again, because tobacco use is already declining sharply, we're kind of on notice that we have to solve those problems anyway. We need to, reframe this problem, remind our legislators, remind the state, remind ourselves that tobacco, as tobacco does not relieve stress, except for the stress caused by addiction, that tobacco money is not free. It's costing us way more than it's giving us in lives and in healthcare and other costs. Every quit attempt or policy proposal is an opportunity to learn what works. It's going to be a process of experimentation. And that's what works for individual cessation. And I think that's what's going to work for the state as well. So it really is time for some new ideas. And a lot of those are going to have to come from you and your coalitions and all of us, because we know what some of these issues are and what they will be, as I've pointed out, but we probably don't know what all of them are. Things will come up. We're going to have to address those. Just like with individual cessation, we have a good idea about some things that probably work, but we probably don't know everything that might work, and we don't know everything that might work in every situation. And we didn't always know in the past how things would work, but we tried them anyway. I mean, I don't think anyone thought in the 1970s when they were arguing for smoke-free sections in restaurants that it would lead us here to where we're talking about an end game, ending the tobacco epidemic in the state and hopefully around the world. So that is what I have, and I would welcome your questions and comments.
I turned my picture off because I seem to be having my little internet problem again, but there was a question in the Q&A, Libby, about other sources of funding or ideas for programs like First Five that are funded from tobacco taxes.
Right, that's one of the many programs that uses tobacco taxes. And I do not know where that money is going to come from. We may, there may be other things that emerge. We may, maybe there will be, for instance, cannabis or alcohol could be an approach. Like I said, don't know. But I have confidence that our legislators will figure out something.
We're on the verge of getting some millions of dollars over the next 5-10 years. I forget what the time frame is from the Juul settlement that the state just achieved. Now, where those monies will go remains to be seen. But I think, the fact is that the state finds ways to move money around or issue bonds to get more money, or and as Libby pointed out, the key issue here is that the state is losing money now on tobacco sales, so it's not really benefiting us. So it really is a matter of getting this issue onto people's agenda who are the state budget planners and having them. I think they are already, they already can see that the monies are going down as smoking continues to drop and as the effectiveness of the programs continues. So these are questions that they're having to grapple with. There was a question about the graph on smoking prevalence in California and the USA. And the question was, there was a little place where an increase occurred. And what presidency was, during what presidency was that? And I'm not sure, I forgot your diagram, what year that was.
Here we go. So there was a bump in 2011, so that would have been Obama. That would have been right after the Tobacco Control Act was passed. But I'm not sure what caused that.
Other comments from people or questions? Ideas about other sources of funding that should be tapped? Well, see, we're not the only ones who don't have the answers. I think the question is, how do you begin to have this conversation? We have to start talking about it for it to be for it to be solved, for people to wrestle with the things that we don't know yet. We need to start saying, what is it that we don't know? Where are we going to get these answers? Somebody says, can you please review the section on TRL in the future?
I'm not sure I understand the question. Maybe someone could clarify.
I think it must relate to the fact that tobacco retail licenses would go away if, in fact, we get to a point where sales are banned.
Right.
But there would still be need for enforcement against illegal sales or illicit sales. I'm assuming that's what that question relates to, but please type in a clarification if that's not.
That, I mean, that is going to be one of the issues that localities will have to confront, rather than it sort of being left up to the state, I think, because we'll probably get a lot more localities ending tobacco sales before the state goes that route. So, again, it might depend on the locality in terms of, what their health budget is like, and, where their other funding is coming from in terms of their tobacco control programs. So, fortunately, I suppose, because those local policies won't necessarily, won't mean that their state money goes away. There should be, continue to be some money from the CDPH and the tobacco control program to continue with enforcement. But, there may be other ways to solve that problem.
It seems that ideally the climate changes enough that this becomes less an issue, because you've also reduced demand simultaneously and continued to reduce demand. And I would think there would be a sort of tipping point on demand as it continues to go down. Another comment here, Texas does not have California's problem since we spend so little on tobacco control, 51st in the nation. Ooh, losing tobacco taxes would not be a big deal. Okay, well then go, let's see Texas move to the tobacco end game. That would be a sight to see, I must say. But I do think it is an issue that, and I've raised this with folks from Australia as well. I think there comes a point where you can't tax your way out, because you're not going to have cigarettes for sale for $1 million a pack and figure that you're going to sell 100 packs a year or whatever it is. So there comes a point where you have to have this conversation, I think, unless you accept that this is always going to be with us as a commercial and normalized consumer product. If you don't accept that, which is the basis for the whole end game conversation, then I think this is a conversation that you have to have. Yeah, and I didn't know, it looks like the assessment of my question is correct. I don't know if you had any more to say about that, Libby, in terms of the tobacco retail license and enforcement issues.
Right, no, just that, yeah, these other sources of funds, like state funds, so, tax dollars from other jurisdictions could basically continue to support some of that enforcement, even from jurisdictions that have stopped the sale. So I think there will be some of that. And, as I said, it may depend on the jurisdiction, how they choose to fund their local, their local health programs.
Another question here, could funding from SAMHSA prevention and enforcement for SINAR be tapped more, or other federal dollars to help with loss of tax dollars to address enforcement? That's an interesting question. And I think I'll just jump in here, Libby, if you'll excuse me, if you can still hear me all right. I think that's interesting because if you in fact did get to a point where the state said, you can't sell this anymore, SINAR is related to purchases of tobacco by minors. And if in fact you say you can't sell this here anymore, then it would be interesting to see whether those funds would be able to be tapped. It's possible they would not, because if you don't have legal retailing, this would fall under an illicit trade enforcement issue rather than a minor purchase issue. But again, it depends on what approaches, if you begin from the local level, there could be multiple approaches taken to this. And so you could potentially tap it for local level enforcement. Certainly, if you could get some strong people working on this at the federal level, and maybe we will have that under our, the administration that we have now. It's hard to say, but the industry is so much more powerful at the federal level. It's hard to say whether more is going to be forthcoming. Well, I guess we'll have to see. I don't know, Libby, Patricia, if you have more to add on that. Another comment here, diversity, equity and inclusion programs have gained in popularity, particularly in health. Where are those funds coming from? I don't know the answer to that question. But this is certainly an equity issue. Tobacco control is increasingly an equity issue. So that is certainly an idea in terms of any funding coming for DEI programs. And another comment on Texas, the governor's chief of staff was a tobacco lobbyist. Oh, so we are kind of happy to live in California, I would say. At the tobacco industry profits should pay for this. Now that's an interesting comment. I think the question is, how would that be done? I think it would have to be done at the national level. And that has been proposed by Anna Gilmore and some of her group in the UK that have proposed taxing industry profits, or taking a chunk of industry profits So not just taxing the products, which are usually those taxes are passed along to the consumers, but actually taking tobacco industry profits directly to pay for the damage that they've caused. I would imagine that would require quite a lot of legal work. But again, I think this is the point, is it's important to be brainstorming about the possibilities and throwing out ideas, because you never know what somebody may take and run with. I understand the increase in prevalence around 2011 was actually just due to a change in data collection. I wondered about that because it sort of looked like a funny little spike there that didn't seem to really indicate a pattern. We also need to divest universities from tobacco research money and tobacco stocks. I couldn't agree more. A lot of that has happened. Certainly, University of California has done that quite a long time ago, and the retirement system is out of tobacco. Can master settlement agreement funds pay for enforcing illegal tobacco sales after prohibition? And of course, we don't like to call it prohibition. We like to call it abolition of sales, or phasing out sales. But I don't know the answer. And again, maybe if there are some lawyers on the call, feel free to type in your opinion about that as far as the use of MSA funds. I think the there would still be some MSA funds coming because those are based on national sales, is my understanding. But what kinds of restrictions there are on using those funds, I don't know. I mean, there are also people who feel that the industry should be prosecuted criminally for their activities, which have been so deeply deceptive for so long, and that hasn't yet happened. But there could be other forms of legal prosecution of the industry that could result in settlement monies that would help to help with the transition. I think that the thing is, one has to think of this in terms of a transition period, because as with any budget, if something goes away, people try to figure out other ways to make up for that. And the state clearly has, for example, a large rainy day fund that we continue to pay into to have for times that are economically hard, or for times when money is going away. So I'm not saying that that should be tapped entirely for this, but the state has money. It does not lack for money. And so I think this is just part of good budget planning. Just as for the retailers, it's part of good planning for the retailers to see the handwriting on the wall that prevalence continues to drop, that this is not going to be a huge profit center for them forever. And that at some point it may not be sold in California anymore, or in their local jurisdiction anymore. So it's about that transition planning. More questions or comments? Be sure I've kept up. Oh, here's another. The civil RICO case was originally a criminal case, yes. But the criminal case disappeared. Yeah. Yeah, the outcome of that case was positive in the sense that they were found to have violated RICO, but it was very disappointing in that the penalties were weakened and weakened and weakened, and the ones that were not done away with entirely were challenged in court over and over and over, and weakened eventually as a result. like the notices they were supposed to publish and so forth. So lots of disappointments there. Patricia, were you going to say something else about that?
No, I was not.
Just looking down to see if there's any other questions here that I've missed. Well, if nobody has additional questions or comments to share with us, we can wrap up and give you a little more of your afternoon back. I did want to say that I think there will be a evaluation coming around, and so we'll be welcoming your comments and questions on that. And we would welcome you to contact us if you have more ideas after this. As I said, this is really about kind of a thought exercise to help get us all in gear for thinking about what this might look like and how we might move in this direction, because we can't simply be doing this one smoker at a time, or one person who smokes at a time, I should say. We're trying to get better at not using this language that's more stigmatizing of people who use these products. But rather than just going one at a time, we're trying to say, okay, what are the structural and political and societal things we need to address for us all to quit smoking? So if you have more thoughts and ideas on this, please feel free to reach out. Anything to add, Libby or Patricia or Megan?
I don't think so. Thank you, everyone, for coming. I appreciate your attention.
Thanks very much, everybody.